Cognitive behavioral therapy is one of the most often recommended treatments for many mental health conditions. It's been shown to help with cases such as anxiety, depression, trauma, basically any mental health condition that is out there. Cognitive behavioral therapy may help with it. And so what the name suggests is that changing one's thoughts, which is the cognitive part, changes one's behaviors. One's thoughts is thought to affect their feelings, which can affect behaviors. And so that paradigm is all related. So if you change any one of those, then the other part of it will change. For example, if you change your behaviors, that may change your thoughts or your feelings. If you change the thoughts, that may change your feelings and behaviors. For cognitive behavioral therapy, the premise is it starts with a thought. For example, if one feels anxious, they're going to get anxious feelings and they're going to have actions that follow that. If one gets sad, they're going to feel sad moods and their behaviors are going to follow that, like maybe be isolated or depressed or maybe look down on the ground a lot. You could do that with really any negative thought can affect the emotions and feelings. So cognitive behavioral therapy essentially examines the thoughts that people are having them ask themselves, is there evidence for, evidence against it? What evidence is true? Another approach is to, would a good friend say that about you? Would a good friend, say you are lousy or you're no good or whatever that thought is? You can fast forward to the end of this video and I'll go through a CBT worksheet. CBT worksheets are often homework assignments that therapists give to their clients to actively work on changing the way they're thinking. They get assignments to do like once a week, maybe once every couple weeks, maybe once a month, sometimes once a day, whatever can sort of fit your schedule, but you can take 10 to 15 minutes, might not even take that long, to really examine whatever intense negative emotions or unhelpful thoughts or feelings are going through. And you can go through this outline, which again, I have an example at the end of this video. So just from a Christian perspective, I think the best way to reevaluate and to assess one's thoughts is to see if it's in line with Christ's teaching. For example, Christ tells us to really look at ourselves before we judge others. And so oftentimes we'll see that our thoughts that are negative involve us judging other people negatively, and that's going to affect actually ourselves, not so much even, it may affect them as well, but really we have to look at ourselves. Also, we may get thoughts that, the president is this or the governor is that, and something negative, which is not really our role necessarily in society, but Christ teaches us that we need to pray for them, and that may help to just trust it's in God's hands and, to try and let go of some of these negative things that might be happening. And so I really do think that deep down, CBT will actually involve core values. And I think that's why it's important to try to line it up with the true principles that essentially are unshakable, that have a good solid foundation. So one of the reasons that cognitive behavioral therapy is so often recommended is because it is easily studied and reproduced through research studies. For example, in research, we have to have things that can be reproduced by people all over the world and that can consistently get these results. Other types of therapy, such as psychodynamic therapy, are not as often recommended just because it's not as easily studied. Doesn't mean it's not as effective, but CBT is more easily studied in research trials than other forms of therapy, and so that's why it's often recommended. What if the CBT doesn't work? Like, what if you try to retrain how you're thinking and trying to do all these things for 3 weeks, 12 weeks, several months, and you're still not able to change the way you're thinking? Well, it might be a good opportunity to check with a clinical doctor to see if it's worth being on medications. Sometimes if the mind is too active or it's hard to control or hard to redirect some of those thoughts, medications can help calm it down, so it's easier for somebody to have control over those thoughts and redirect them. So be sure to encourage the growth of this channel by subscribing if you haven't already, and you could feel free to write in the comments of what other videos or topics you'd like me to go over. Thanks so much. So we'll go through the CBT worksheet. This is just an example that was downloaded from the internet on PDF form. So the first column says negative or unhelpful thought. Let's say, for example, that I'm lousy. Okay, is this thought necessarily true? Maybe there's some parts, lousy, but others I'm good at. So there's some things I'm good at. There's some things that maybe are lousy about me. This thought makes me feel sad, and you can rate it on a scale of 1 to 10. Maybe 10 being the most severe, 1 being the lowest. Maybe it's like 4 to 10. Maybe it's frustrated. Maybe that's a little bit higher, 5 out of 10. And they think that just the process of rating the intensity of the emotions will help it to go down. This thought makes me want to stop feeling lousy. Maybe it'll motivate us to do better. Or maybe this thought makes me want to this thought makes me want to isolate, or makes me want to get my mind off my thoughts, or like distract oneself. So evidence for the thought or evidence against it. So you can just ask yourself, what evidence is there that I'm lousy? Maybe my parent told me it, or my spouse or colleague. Evidence against it. Maybe maybe my parent or spouse did not. Maybe they said I'm not lousy. Maybe they said I'm great or encouraging. Maybe you could note some accomplishments or some things that are good. That's don't think you're lousy. What would you tell your best friend? Or example, what do you think your best friend would say? No, you're not lousy. You're just going through a difficult time. Or just focus on your positive qualities. Or I'm not sure why why say that about yourself. And then a more helpful thought is, and so now you can kind of change. This is kind of where you think I'm not lousy, but I'm just have some weaknesses I need to work on. And that's a more helpful thought. Okay, let's go through it. Next example. Negative or unhelpful thought is, let's see, worried I'll get in a car accident. Is this not necessarily true? It's possible, but not necessarily true. Okay, this thought makes me feel worried, maybe on a scale of 6 out of 10, scared, maybe that's 5 out of 10, overwhelmed, maybe that's 3 out of 10. This thought makes me want to take public transportation, or stay inside the house. Evidence for the thought is, maybe there's like 0.5%, this is an example, 0.5% of people getting behind the wheel get in an accident. So that would be 4. Evidence against, there's greater than 99% that there is no accident. What would you tell your best friend? Maybe a best friend would say, so this is usually what would your best friend tell you, not what would you tell your but maybe there's a very slim chance you'll get in an accident, or maybe let's say like you haven't gotten in an accident yet, or maybe you've gotten in an accident once over the year, but maybe help to put in proper perspective. A more helpful thought is driving a car puts one at risk for a motor vehicle accident. So they think that just by changing the way you think, then you can change the way it'll sort of help the whole process going. So in other words, whatever negative thought or unhelpful thought is here, you want to kind of go through this pattern step by step. And this is like a homework assignment that's often given to people through cognitive behavioral therapy, like in a therapy session. You may want to do it weekly, or maybe 2 times a month or monthly, or for some people daily. And basically, thoughts affects feelings, affects behaviors, and so forth. So that's an example of a CBT worksheet.